could be injury to the glands, which we mentioned. If the correct technique is used, should not have these complications. You can have problem with restriction of the urination. But like we mentioned, the complication rates are very low. So in terms of pain control during the circumcision, I actually try to watch a lot of the Mohels in America, in LA, in Israel, wherever I keep in touch with them also. And I would say the Mohels, most of them in some form, they use some sort of anesthesia, if not before the procedure, more after. The glucose, the oral glucose has actually shown scientifically, medically, to show that it does decrease the pain. It does not completely eliminate it, but one advantage with the techniques that the Mohel use, the traditional Mohel use, is that the procedure is a lot faster and less painful, especially if the clamp is not used. So, so they're able to do it like many times in like 30 seconds or a minute, as opposed to the other techniques like gum plastic, like it could be like 15 minutes, and involves a lot of cutting and clamping. So that's, you have to bear that in mind when they recommend about pain management. So it's something that could be done with minimal things, or it could be done with more interventions like local, like an injection. For a regular circumcision, I try to do the best. I try to use the different combinations, cream before and after, and most of the time I use injection. But I usually leave it up and discuss with the parents to see also what they want. And
how often do you do an injection?
Basically most of the time I do almost.
Yeah.
Yeah.
Does it seem to be better for the baby? Like, are they?
Well, it does decrease the pain. But again, like I was mentioning, you have to see, like if they're drawing blood for anesthesia, they're doing for a blood draw, a health stick for a baby. So it's also painful, but since it's so quick, it does not pay to do.
The Mohel draws blood?
No, I'm just saying compared to other procedures that you do for a baby, or even adults. So it's always, you have to always look at the risk and the benefit, and to see if the procedure is quick, and then you can a lot of times do away without pain control. But again, it depends on the technique used, and also how fast the Mohel is, and also how I also try to empower basically the parents to see how they feel, and then basically we leave it up to the parents to discuss together.
So how many out of, what percentage do you do the injection?
I do probably 90%.
Okay.
Yeah, like I mentioned, I'm more into pain management and anesthesia, so I usually use it very commonly.
And it's just a shot, right?
Yeah, it's an injection. I usually try to use a cream beforehand. I have the parents put on a cream and a numbing cream beforehand, so the baby won't feel the pain of the injection so much.
Yeah.
A lot of doctors don't do that, but it's like an additional thing we do. And I also use oral medications, and I also use a cream afterwards for pain after the procedure. And I use the techniques that are usually similar to the Mohel, so it's also faster and less painful. But again, it's something that can be variable. Some parents can want with just cream, some don't, and some do without. Sometimes just use Tylenol. So in terms of the timing, like we mentioned, ideally I would like to have, as a coach Brit mila, we would like to have it on day 8 or later. Sometimes it can be delayed for different reasons, especially if, for example, if the baby is jaundice or if the baby has a sickness. But if it's performed beforehand, then it would be invalid as a Jewish perspective. But it could be fixed, usually by letting a small amount of blood, which is very quick and not very painful. What is worse is if the circumcision is done by a doctor who does not remove enough skin, and sometimes the baby afterwards almost looks uncircumcised, and that is more complicated to fix to make it kosher. But if it's if it's done, performed the same way as a mohel would do, then it's easier to fix. But ideally, better to save the trouble, and just start with someone that gonna do it in a kosher way, so you don't have issues. A lot of times, even take children that grow up in a traditional or non-religious families, they grow up to become more religious, or they go to Israel, and then they want to have a kosher bris, and then it's more complicated to fix it when they're older. So it's a lot easier to do
and
it.
more painful.
Yeah.
When they're adults.
And in many ways, I would say the way the mohels do is more humane. Like in the nursery, like I've seen a lot of doctors do circumcision of a baby in the nursery. Basically, they take the baby and the parents are not there in the room, and they strap the baby down, and then there's nobody. The parents are not there to calm the baby. But as opposed to a Brit mila, where the parents are there, instead of trapping the baby, you hold the baby's leg, and the family's there, and then it's usually a lot quicker procedure too. And like I mentioned, monitor a lot. I watch a lot of mohels, and a lot of them use also very sterile techniques. They use the autoclave their equipment, the same as the doctors do, and use like a sterile field.
You saw a Mohel who did strap down the legs. Is that something that you do?
I try not to. I try to avoid it unless the parents don't want to hold the baby. I like to not strap the baby. Like I mentioned, I try to have the parents, even when I do circumcision, instead of strapping the baby, I'll have the parents hold the baby's legs.
And at that age, they're not quite as wiggly. And that's what he's saying. When you get past a few months, a month or two, they start wiggling, and it's a lot harder to hold the child.
Today, the 5-month-old was okay. we were able to just do it without strapping. Also, even him, but he did well.
Don't want to slip though,
I'm sorry.
You don't want to slip.
No, it's usually they at this age they're not able to put their legs in the way or anything. So as long as someone's holding the legs out of the way, there won't be a problem. When they get older, then they start rolling, start reaching, and then that's when you need general anesthesia to also, or just sedate them so they won't be so active. So after the procedure, usually a bandage is applied, and the parents are given instructions to take care of it. And usually the ceremony is performed. I guess the different honors I can talk about this, right? So usually the person who, in Jewish practice, usually we have one person who holds the baby.
On page 10.
Yeah, I'm kind of skipping around here today.
What you're talking about.
Right, yeah, that's correct. Page 10.
10.
Right. So the kavatar on top would be usually it's an optional thing. You can have a couple bring in a child, and it's considered a good omen for them to have children also if they have problems. And they're pass the baby to the father usually, and then usually there's a chair. There's a sign called Elijah's chair. A lot of synagogues have a specific. You might have seen a long, tall chair, but if you don't have that, if you're doing it at home, also you can just take any chair and just sign it as Elijah's chair. And the tradition is that Elijah is supposed to appear in every Brit mila, and that's why we have the chair. And then the sandik usually is the person which is considered the highest honor, that is going to hold the baby during the ceremony, during the procedure. Usually holds the baby on his lap, and it's also supposed to be a good omen to become rich, and a big honor. And then Mohel, as we mentioned, the person who's performing the procedure, since this is Brit mila is a covenant, he also needs to be part of a covenant. Needs to be someone who was